What is chronic fatigue syndrome? Chronic fatigue syndrome, CFS, also known as myalgic encephalomyelitis, is a complex, fatiguing, long-term medical condition that is diagnosed by cardinal symptoms, but often involves a broad range of symptoms. Distinguishing core symptoms are lengthy exacerbations or flares of the illness after ordinary minor physical or mental activity, greatly diminished capacity to accomplish tasks that had been routine prior to the illness, and unrefreshing sleep or insomnia. Orthostatic intolerance, difficulty sitting and standing upright, or cognitive dysfunction is also a characteristic diagnostic sign. Other frequently occurring symptoms may involve numerous body systems in those affected, and chronic pain is common. While the cause is not understood, proposed mechanisms include biological, genetic, infectious, and physical or psychological stress affecting the biochemistry of the body. Diagnosis is based on a person's symptoms because no confirmed diagnostic test is available. The fatigue in chronic fatigue syndrome is not due to strenuous ongoing exertion, is not much relieved by rest, and is not due to a previous medical condition. Fatigue is a common symptom in many illnesses, but the unexplained fatigue and severity of functional impairment found in chronic fatigue syndrome is comparatively rare in other illnesses. Persons with chronic fatigue syndrome may recover or improve over time, but no therapies or medications are approved for the illness. Treatment is directed towards symptomatology. The CDC recommends the use of pacing, personal activity management, to reduce the worsening of symptoms resulting from mental or physical activity. Limited evidence suggests rintatilimod, counseling therapies, and graded exercise therapy might benefit some patients. The incidence of chronic fatigue syndrome is about 1 in every 100 persons seen in primary care settings, but estimates vary widely due to different illness definitions used in epidemiological studies. It has been estimated that 836,000 to 2.5 million Americans and 250,000 to 1,250,000 people in the UK have chronic fatigue syndrome. Chronic fatigue syndrome occurs 1.5 to 2 times as often in women as in men. It most commonly affects adults between ages 40 and 60 years, but can occur at other ages, including in children. Other studies suggest that around 1 in 200 children have chronic fatigue syndrome, and is more common in adolescents than younger children. Chronic fatigue syndrome is a major cause of school absence. Chronic fatigue syndrome has a negative effect on health, happiness and productivity, but there is also controversy over many aspects of the disorder. Physicians, researchers and patient advocates promote different names and diagnostic criteria, while evidence for proposed causes and treatments is often contradictory or of low quality. Chronic fatigue syndrome signs and symptoms. The United States Centers for Disease Control and Prevention, CDC, recommends these criteria for diagnosis. Greatly lowered ability to do activities that were usual before the illness. This drop in activity level occurs along with fatigue and must last 6 months or longer. Worsening of symptoms after physical or mental activity that would not have caused a problem before the illness. The amount of activity that might aggravate the illness is difficult for a person to predict, and the decline often presents 12 to 48 hours after the activity. The relapse, or crash, may last days, weeks or longer. This is known as post-exertional malaise. Sleep problems. People may still feel weary after full nights of sleep, or may struggle to stay awake, fall asleep or stay asleep. Additionally, one of the following symptoms must be present. Problems with thinking and memory or cognitive dysfunction, sometimes described as brain fog. While standing or sitting upright, lightheadedness, dizziness, weakness, fainting or vision changes may occur. Chronic fatigue syndrome. Other common symptoms. Many, but not all people with chronic fatigue syndrome report muscle pain, joint pain without swelling or redness, and headache. Tender lymph nodes in the neck or armpits. Sore throat. Irritable bowel syndrome. Chills and night sweats. Allergies and sensitivities to foods, odors, chemicals, lights, or noise. Shortness of breath. Irregular heartbeat. The CDC proposes that persons with symptoms resembling those of chronic fatigue syndrome consult a physician to rule out several treatable illnesses. Lyme disease, sleep disorders, major depressive disorder, alcohol, substance abuse, diabetes mellitus, hypothyroidism, lupus, multiple sclerosis, chronic hepatitis, and various malignancies. Medications can also cause side effects that mimic symptoms of chronic fatigue syndrome. Central sensitization, or increased sensitivity to sensory stimuli such as pain have been observed in chronic fatigue syndrome. sensitivity to pain increases after exertion, which is opposite to the normal pattern. Thanks for watching our video. Make sure you subscribe to receive more video related to chronic fatigue syndrome treatment, and many other everyday health and wellness. Thank you so much for watching.